scenario is that the patient is in a psychiatric and mental health facility. She has a history of anxiety. She was diagnosed 5 years ago, and today it's her second day of being in the hospital or in the facility, and she has recently hurt herself and voluntarily admitted herself to the unit. So this is an interview that we're going to just kind of assess where she's at this point. So we'll go ahead and get started with the interview. So Sarah, what thoughts are you having right now about harming yourself?
Well, I'm not really having any right now, but it's just usually when I get sad or anxious and I just want to cut myself. But I don't do it to die or anything. It's just, I don't know, just I guess to feel something.
Yeah. So what feelings were you having before you cut yourself recently, when you cut too deeply?
I don't know, like I said, I just kind of wanted to feel something, anything. I was so anxious about all of the bills I have from college and all the student loans and everything. I just can't keep up with it, and I just feel I'm just getting so behind. And then on top of it, I had to move home with my parents, which is just so frustrating. And then I don't know, I was really scared that my parents were going to be seriously super mad at me, and they're really strict. So I don't know, they're probably just saying really irresponsible for, on top of it, not paying my bills, and then just getting way in over my head. So I was just overwhelmed, and at the same time I just felt I'm just not getting anything out of life, just I'm just kind of sitting around doing nothing.
Yeah. Sounds like you were so overwhelmed by all the difficult things that you were facing, and you just really didn't know how to deal with it.
I mean, honestly, I just feel like such a failure, and I can't do anything right, it's just so annoying.
It seems like you must have been feeling really anxious to want to cut yourself, because it's a way to make yourself feel better, but it's probably not a very positive way. And in the long term, you're kind of, harming yourself. So what do you think about maybe learning some different ways to cope with your feelings and your anxiety?
Yeah, I mean, I just hate myself for doing this, but I just don't see any way out. Honestly, I just really don't. And I mean, yeah, I guess I could try to learn some stuff, but I just feel really stuck in this hole kind of. But I mean, I did come here, to try to stop doing this, because I know that it's not safe, and I guess. But
well, I'm really glad you did, because we're going. It's a good thing that you want help. It's a good sign, because we can definitely work on that. So. Okay, for the ISBARR, I am Rachel, the RN that's been caring for the patient, the client, here at the psychiatric facility. She is a young adult female, and she was admitted at 1900 yesterday evening for self-mutilation. She has a history of cutting in the past and was diagnosed with anxiety 5 years ago. But she has been on an anti-anxiety medication for those 5 years, and up until recently has not been using the cutting to lower her level of anxiety. Recently, what had happened in her life is that she experienced an increase in stress and anxiety that was related to moving home with her parents and having quite a few bills, and that was really overwhelming for her. And so she started to cut again, and apparently she had cut a little bit too deeply one of the times, and she had ended up in the emergency room, and then was willing to come over to the facility and get treated as a voluntary patient. She stated that she does not want to hurt herself anymore, but that she doesn't trust herself not to do it again if she's stressed enough. And she states that currently she does not want to self-harm, but she denies ever having any suicidal ideations, and she does not want to die. The patient has no allergies, and she's medically healthy otherwise. My assessment of the client indicates that the situational stress that she's been feeling has exacerbated it's increased her risk for self-harming and exacerbated her anxiety. So she does appear to be moderately depressed as well, which could be situational. Her vital signs were normal, except for her heart rate and BP were slightly raised, but they were still within normal ranges. She denies any suicidal ideations, hallucinations, flashbacks, or cravings. She does report a decreased appetite, and she only eats about 50% of her meals for the meals that she's had in the hospital since she's been here. And she also reports restless sleep. She's attended no groups so far, but she has come out of her room to the common area for both the breakfast and the lunch, and then returned to her room. And until the medication reconciliation is done and completed, she has not been given any meds at this time. My recommendation is that we administer a psychological examination and work with her on a plan of care and goal setting. She may also need additional anti-anxiety medication, at least for the time, until we can assess further for whether she would need to be on that long term. She may need some therapy as well to help her identify her strength and find new ways of coping. At this time, we're waiting for orders from the attending physician to begin a new anti-anxiety med, and